today's topic will be the degenerative changes that take place with the disc. There are various stages. We'll start off with normal, that the disc can undergo as a result to traumatic events, car accidents, sports injuries, wear and tear, aging process. The disc can undergo changes that are degenerative in nature. This represents a normal disc. And as you can see the nucleus propulsus in the center, and you have annular fibers that create rings, concentric rings, around the disc propulsus here. Now, if these rings get weak due to a dehydration or degenerative changes, then this material in the center has the propensity to bulge through it. This model shows a situation where we have a disc bulge and it has created an overall distortion of the disc itself. You can see that this material here in the center has migrated towards the nerve root and the spinal cord here in the center. This situation can be very painful as it creates stress to the spinal cord and stress to the nerve root that exits out from that spinal cord at that spinal level. This represents a herniation of the disc, where the material, the nucleus propulsus, has exited completely. Well, not completely, but exited out of the center here where it belongs. And now, because this material is foreign to the body will attack that region because this is foreign. This has the ability of putting pressure on the spinal sac, the thecal sac of the cord, and also the nerve root as it exits out from the spinal cord. That creates pain, it creates an inflammatory response. It also creates a situation where you may have numbness or tingling or any other such conditions that create pain as it relates to a nerve impingement. As time goes on, if this remains a problem where there's constant insult to the nervous system as it relates to disc bulges or herniations, the body feels the need to basically start its own surgery. It starts to lay down these spur-like configurations around the end plates of the vertebra themselves. And you can see that spurring. It's kind of like a jagged edge. And it changes the overall shape of the vertebrae as the vertebrae start to degenerate also. You can see here that the space between the vertebrae is much less than in the normal presentation on this one. You can see how thick that is compared to the degenerate side. Very, very significant difference in disc height. You can also see here on the vertebrae here, this one, that the bridging that's taking place is very, very successful. I mean, it's going to fuse eventually right in this area here. That can be very problematic. Basically, the body is trying to fuse the bones together so as to create stability in the structure as a whole. Stability is important because with every movement, as that disc is pumping, it can create more insult to the nerve root as that herniation pushes into the nerve root, creating pain. Now, those are the degenerative stages that take place, and just to review, I have a little chart here that shows each of the vertebrae. We have the normal one right here. We will move over now to the herniated disc. And as you can see, it can create all kinds of problems and impingement to the nerve root, right in that area there. And we look over to the other side right here, where you have degenerative changes occurring to the bone itself. And you also have here some more significantly changed bone right in this area here. So thank you very much. That concludes this segment. Please feel free to contact us if you are having any difficulties relating to herniated or bulging disc. I am Dr. John Thomas, owner and founder of Allied Healthcare Clinics, a premier spinal decompression facility for your healthcare needs. Please contact us at 770-460-1911. I'll be more than happy to assist you with any questions or even provide you with a free consultation to get you out of pain and back to living a pain-free life. Thank you.